When Allied forces captured the Afrika Korps in Tunisia during May 1943, they took roughly 275,000 German and Italian soldiers prisoner. Buried within this massive group were German medical officers who would face something the military world had never quite seen before. They would be treated not as vanquished foes locked away, but as professional colleagues deserving respect. What follows is their story, drawn from careful historical documentation and verified first-hand accounts. The Geneva Convention of 1929 had established unique protections specifically for medical personnel captured in wartime. These carefully drafted rules would fundamentally reshape how German doctors experienced their captivity in American hands. The convention required that all prisoners be treated equally, which meant German medical officers received the same military pay as their American counterparts. Officers could not be forced to labor. Medical personnel specifically could not be compelled into non-medical work and kept certain professional standing. As a signatory to these international agreements, the United States committed itself to enforcing these protections rigorously. What struck German medical officers most forcefully was that American commitment to international law actually surpassed what they had known under their own military system. When the first waves of German POWs arrived, they came aboard Liberty ships that would have sailed empty otherwise, with crowds as large as 30,000 arriving monthly at ports near New York or Virginia. From the moment they boarded, something felt different. The meals alone told a story of American abundance. The voyage itself offered the first window into American resources and their philosophical approach to prisoners. Unlike the packed freight cars that transported captives across Europe, German medical personnel occupied proper passenger berths with consistent filling meals. This simple logistical choice sent a powerful psychological message that reverberated through the minds of these men. Through late 1943, German POWs dispersed across camps scattered throughout America. Texas, with its climate roughly matching North Africa and therefore meeting Geneva Convention specifications, became home to an especially dense network of detention facilities. That same year saw authorization for 3 additional camps to open. San Antonio's Fort Sam Houston consisted basically of a canvas city, dotted with 176 tents, housing both prisoners and their American guards. Gainesville's camp houses and Killeen's Camp Hood North joined the network. Medical capabilities at these locations varied, though they generally surprised German medical officers with their adequacy. These camps contained infirmaries and sometimes substantial hospital structures where German medical personnel could practice their profession. The truly remarkable element of their experience was professional acknowledgement from American medical leadership. Documented cases showed German physicians treating American soldiers, while captured American doctors worked with German wounded. Across the board, captured doctors found themselves treated as esteemed professional equals by their counterparts. One American physician described freely exchanging surgical techniques and knowledge with German colleagues. The American Medical Corps consistently delivered identical care to German prisoners as to Allied wounded. This professional regard extended beyond ceremony into daily practice. German doctors heard their titles, participated in medical consultations, and joined clinical discussions as genuine peers. This recognition starkly contradicted what Nazi propaganda had led them to expect from American society. American POW camps invested substantially in medical infrastructure. The Butner Camp Hospital alone treated approaching 14,000 patients. Beyond basic recovery, it supplied social readjustment support, guidance programs, technical training opportunities, vocational counseling, and classroom instruction. By late November 1945, approximately 2,200 staff members worked there, supported by 414 German prisoners, delivering round-the-clock patient attention. These facilities merged American military personnel with POWs in an integrated medical setting, where German medical staff worked shoulder to shoulder with American practitioners. Equipment quality and pharmaceutical supplies often rivaled or exceeded what German military hospitals possessed, even during peacetime, before wartime destruction ravaged their infrastructure. German prisoners, especially medical officers, accessed educational programs that would have impressed even civilians. Nearly every camp maintained libraries stocked with donated volumes and periodicals, some collections substantial enough to rival solid high schools. Camp Fanning, for instance, kept over 2,500 books with an impressive 80% checkout rate. Medical personnel gained access to current medical journals and literature, materials that had been restricted or prohibited in Germany due to wartime conditions and Nazi suppression of non-Aryan medical knowledge. Certain camps developed striking partnerships with American universities. April 1945, records from Camp Bertner documented 110 prisoners employed in support positions at Duke University and UNC. While these positions involved non-medical work, the university connection gave German medical officers in the camp exposure to American academic medical advances that would have been impossible otherwise. These university links, though limited in scope, represented integration between enemy captives and American centers of learning that Nazi Germany would never have permitted. As America dispatched millions of soldiers abroad, labor shortages intensified, leading German POWs to contribute to the Allied effort through work in canneries, textile mills, farmland, and other sites considered lower security concerns. Medical professionals frequently worked in hospitals and clinics, where their expertise proved genuinely valuable. German medical officers choosing medical assignments earned compensation based on rank and duties, following Geneva Convention mandates. Though modest, this payment acknowledged professional standing, an enormously meaningful distinction for men braced for treatment as beaten enemies. Growing numbers of German POWs created fresh complications. Initially, some American nurses questioned whether they could set aside personal feelings and deliver optimal care to these particular patients. Hospital policy clearly prioritized Allied casualties over enemy prisoners. Most nurses, however, discovered themselves capable of seeing these individuals purely as patients requiring medical attention, providing identical treatment regardless of uniform. This professional fusion proceeded despite starting doubts and official hierarchies favoring Allied welfare. American medical workers' capacity to distinguish professional responsibility from national hostility offered German medical officers a conception of medical ethics transcending political boundaries. German medical personnel witnessed pharmaceutical and supply abundance fundamentally incompatible with their wartime scarcity. Basic supplies, bandages, medicines, instruments existed in quantities German military medicine had abandoned years earlier. Sulfur-based medications particularly astonished German physicians, having been strictly measured out in their system, yet dispensed generously here. When penicillin appeared in select facilities during 1944, it represented curative potential German medicine altogether lacked. Care extended to German POWs matched or exceeded American military standards. German wounded received equivalent surgery, pharmaceuticals, and recuperation services as American servicemen. This parity, mandated by convention though routinely ignored elsewhere, remained consistently honored in American settings. German medical officers witnessed and contributed to this equal standard, gaining familiarity with American medical methods and principles that would guide their medical careers afterward. Texas contained numerous detention facilities, concentrating German prisoners, including medical professionals, across approximately 40,000 acres, spanning roughly 63 square miles in Granville, Person, and Durham counties. Camp Butner functioned as an infantry facility and hosted training scenarios for estimated 30,000 soldiers. German and Italian captives arrived at Camp Butner, where they worked as kitchen staff and handled numerous assignments. These installations' magnitude and medical departments exposed German medical officers to American military medicine at peak development. Growing devastation in Germany rendered this contrast increasingly profound. Professional bonds between American and German medical personnel, while limited by captivity circumstances, included authentic professional discourse. American doctors absorbed battlefield trauma management from German colleagues possessing substantial combat surgical experience. German physicians absorbed American breakthroughs in antibiotics, pain management, and surgical methods. Post-war writings and military files recorded these professional exchanges, signifying wartime professional cooperation between adversaries without historical precedent. Nurses' involvement in American medical practice demonstrated approaches unfamiliar to German medical officers. American nurses commanded more autonomy and decision-making authority than their German equivalents. executing procedures and directing care decisions that German tradition reserved for physicians alone. German medical officers collaborating with American nurses encountered an altogether different professional structure, requiring adaptation that challenged their preconceptions regarding medical hierarchies. Starting September 15, 1942, Fort Sam Houston allocated space accommodating roughly 1,000 German captives until permanent camp infrastructure could be completed. As the birthplace of Army medicine and the Combat Medic Training Center, Fort Sam Houston's status as a premier medical education hub meant German medical personnel encountered American approaches to military medical instruction and preparation. Though participation remained restricted, exposure to American medical training furnished fresh perspectives on medical education methodology. Dental care, frequently overlooked in historical examination, offered additional opportunities for professional cooperation. German dental specialists operated within camp dental departments, caring for thousands of prisoners' oral health. These dental professionals received identical recognition as their medical counterparts. American dedication to prisoner dental health, emphasizing preventive maintenance rather than extraction-only approaches, reflected commitment to comprehensive prisoner welfare surpassing convention standards. German medical officers engaged in camp health initiatives addressing disease prevention, sanitation management, and health instruction. This exposure to American public health doctrine, prioritizing prevention alongside treatment methodology, departed from German military medicine's concentration on immediate battlefield injury response. The public health strategies implemented across these detention facilities proved remarkably effective, keeping disease outbreaks minimal despite the heavy concentration of prisoners. What stood out most to German medical staff was how American preventive medicine worked, a sharp contrast to what they'd known back home. The Americans recognized combat fatigue, what doctors today call PTSD, as a genuine medical condition requiring treatment. In Germany, the military had treated such cases as weakness or cowardice. Here, prisoners encountered psychotherapy, occupational activities, and medications working together as a coordinated system, addressing mental health comprehensively. This represented something entirely different from what German military psychiatry had practiced. By the time the war wound down, German medical personnel faced the prospect of returning to a homeland in ruins. Many had spent over 2 years in American hands, practicing their profession under circumstances that often surpassed what they'd experienced as physicians back in Germany. The journey home included thorough medical examinations and certifications, handled jointly by American and German doctors. This final professional collaboration deepened the collegial bonds that had grown during their time in captivity. Following repatriation, roughly 5,000 German nationals chose to stay in America, while thousands more eventually returned for visits. Farmers who'd employed German prisoners recalled them warmly, many developing genuine friendships that lasted decades. Professional relationships extended to medical personnel as well. German medical officers who went back to Germany carried with them understanding of American medical practices, how medical systems were organized, and the ethical standards underlying American medicine. Measuring this influence precisely remains difficult, yet the impact on post-war German medicine was substantial, especially regarding medical ethics, how patients were treated, and professional conduct. The way American medical education emphasized hands-on clinical work, combining theoretical knowledge with practical experience, and the structured approach to training residents. These elements deeply impressed German medical officers. Several who'd experienced American captivity became influential medical educators, rebuilding German medical schools after the war. Establishing direct connections between their teaching approaches and their prisoner experience requires access to personal archives and institutional records that historians simply don't have. Available documentation includes military records housed in the National Archives, reports from International Red Cross inspections, memoirs published after the war, recorded oral histories, newspaper articles from the time, and publications prisoners created themselves in camp. While these sources offer valuable perspectives, significant gaps remain regarding the full scope of professional relationships and how much knowledge actually transferred between the two medical communities. German pharmacists and pharmaceutical specialists learned about American drug manufacturing methods, how quality was controlled, and how medications reached patients through distribution networks. These insights proved invaluable as Germany rebuilt its pharmaceutical sector. The sheer abundance of medications visible in American camps, everything from basic aspirin to cutting-edge antibiotics, revealed production capabilities Germany's pharmaceutical industry had never matched. Witnessing this pharmaceutical abundance reshaped how German medical personnel understood modern medicine's potential when resources were adequate. The exchange involving surgical knowledge provided perhaps the most practical benefit of professional interaction. German surgeons, many carrying years of battlefield experience, shared techniques they'd developed treating combat injuries. American surgeons, in turn, demonstrated advances in pain management, sterile procedures, and recovery care. Though language differences and security concerns limited this two-way knowledge exchange, both medical communities gained from it. German technicians and laboratory workers in camp medical facilities performed standard diagnostic testing and supported daily medical operations. They became familiar with American laboratory procedures, equipment designs, and quality assurance methods that frequently exceeded what German military laboratories had maintained. The systematic nature of American laboratory practice, standardized procedures, regular equipment servicing, meticulous record-keeping, provided templates that post-war German laboratory medicine would adopt. German radiologists and X-ray technicians working in camp medical facilities gained respect for American radiology equipment, particularly its dependability and image clarity, quite different from the aging, difficult-to-maintain equipment they'd worked with previously. American radiology safety practices, including protections against radiation exposure for both patients and staff, went well beyond what German military standards required. This exposure to radiation protection influenced how German radiologists approached their work after the war. The International Red Cross served as a vital bridge throughout this experience. Inspections confirmed that medical staff were treated according to Geneva Convention standards, receiving appropriate professional recognition and suitable work assignments. Red Cross packages sometimes supplemented medical supplies, though American military hospitals generally had sufficient stock. More significantly, the Red Cross maintained connections between German medical personnel and the broader international medical community, preserving awareness of ongoing medical developments worldwide. Many camps produced newspapers written by and for the prisoner population. American censorship reviewed these publications but permitted substantial freedom of expression, including medical articles written by German medical professionals. These pieces addressed health education, disease prevention, and medical news, allowing German medical personnel to preserve their professional standing and disseminate knowledge among fellow inmates. Camp newspapers preserved in archives today offer windows into how German medical personnel viewed their circumstances. A limited number received permission to conduct medical research while in captivity. Projects focused on uncontroversial subjects, nutritional problems among prisoners, or disease patterns within camp populations, let German medical researchers maintain their scientific abilities. Having access to laboratory equipment and statistical assistance represented more opportunity than many German researchers possessed during wartime when Germany's research facilities were deteriorating rapidly. Communicable disease outbreaks in camps demanded coordinated responses that brought American and German medical personnel into urgent partnership. Whether tackling influenza, intestinal infections, or other illnesses, these crisis situations exposed German medical personnel to American disease control methods and public health procedures. Participating in epidemic investigations, implementing containment strategies, and organizing mass treatment programs gave German medical professionals practical experience directly applicable to post-war Germany's severe public health challenges. German medical officers studied how Americans managed medical supplies, maintaining consistent availability of necessary materials. The structured approach to tracking inventory, keeping emergency reserves, and organizing distribution networks supplied blueprints for streamlined medical logistics. Understanding how modern medical systems could sustain reliable supply even facing difficulties proved especially relevant to Germany's need to rebuild its destroyed medical infrastructure. Watching American surgeons treat combat injuries in camp hospitals exposed German personnel to advances in wound management. Americans used antibiotics generously to prevent infection, performed careful surgical wound cleaning, and maintained systematic documentation, all improvements over German military practice. Observing and participating in American wound care approaches shaped post-war German trauma medicine, ultimately benefiting civilian accident victims. The American commitment to preventing disease in POW camps revealed a medical philosophy emphasizing prevention. Regular health checks, immunization initiatives, and health information programs demonstrated prevention's practical value. Though German medicine recognized prevention, the military had prioritized battlefield medicine, leaving prevention relatively neglected. Experiencing comprehensive prevention-focused programming influenced how German physicians practiced after the war. German medical personnel witnessed American rehabilitation medicine for injured soldiers, an approach emphasizing restoring maximum function rather than simply providing pensions to permanently disabled individuals. Physical rehabilitation, activity therapy, and job training programs surpassed anything German military medicine offered. This exposure shaped post-war German rehabilitation medicine development. American medical professionals communicated differently, both with patients and in written records. Documentation was thorough and accessible. Patients received clear explanations about their conditions, and medical teams collaborated openly. German medical personnel adopted these communication practices after returning home, contributing to medical care that placed greater emphasis on respecting patients' autonomy and fostering cooperation among healthcare providers. The entire experience of German POW medical personnel in American captivity illustrates that professional identity can withstand national conflict. American medical leadership treated captured German physicians as valued professional peers, engaging in genuine exchange of medical knowledge and techniques. The relationships formed extended beyond the war's conclusion. While full documentation of knowledge transfer and professional relationships remains incomplete, evidence demonstrates that German medical personnel received professional respect, exceeding their expectations and frequently surpassing their experience in German military medicine. This respectful treatment wasn't perfect or universal. Security requirements, communication challenges, and the fundamental reality of imprisonment-captivity relationships restricted full professional partnership. Certain American medical professionals maintained deliberate distance, and some German personnel rejected American approaches. Nonetheless, the documented record of German POW medical personnel in America constitutes a significant chapter in the history of military medicine. Treating adversary medical personnel as respected professional colleagues reflected American commitment to international legal obligations and core values within American medicine itself. The consequences extended beyond individual German medical officers to reshape post-war German medicine broadly. Establishing definitive causal connections proves challenging, yet German medical officers who learned American medicine while imprisoned contributed significantly to rebuilding German medicine after the war, introducing American procedures, ethical frameworks, and organizational principles. Ultimately, German POW medical personnel's time in America reveals medicine's remarkable capacity to preserve professional solidarity despite warfare. By showing professional respect toward captured enemy physicians, American military medicine upheld international legal standards while embodying principles that rose above conflict itself. This historical example remains instructive for contemporary military medicine and cross-border medical collaboration. The concept that medical professionals bear responsibilities transcending national allegiances, demonstrated through American treatment of German POW medical personnel, continues shaping military medical ethics and international medical cooperation today. German medical officers who encountered American professionalism instead of expected hostility returned home carrying far more than technical expertise. They brought personal experience confirming that professional respect endures through war, that medical ethics supersede political divisions, and that physicians who were enemies could become allies pursuing medicine's shared purpose of helping the sick and injured.